Welcome to the Poisoning Podcast. I'm your host, Erin DeLulo. Please like, review, and share this episode with a friend. Today's guest is Jonathan Holth. He has a very interesting story. I think 17 years sober, is now in the governor's cabinet as a Recovery and Reentry commissioner. It's the first I've ever heard of that title nationwide. He also is a restaurateur and runs a name, image, and likeness collective in North Dakota. Jonathan, thank you for joining us on the Poisoning Podcast.
Happy to be here. Thanks for having me.
Yes, I was excited to discover you, honestly.
Thank you.
I did so through our mutual friend, Rob Port. I saw that you were on his podcast, and I said, I had never heard of someone with a cabinet title of Recovery and Reentry. There's so many drug czars out there.
Right.
And we have one here in my state of West Virginia, and he's a great guy. His name is Dr. Stephen Lloyd. You've probably heard of him.
Dr. Lloyd is a good friend of mine and one of my heroes, so I know him well. Yes.
But I love this title.
Thank you. I do too.
Did you come up with it?
The governor and I worked together on it. When the governor decided that he wanted to have this role that we're sort of creating as we go here, we bounced a few titles off of each other, and frankly didn't love any of them. And I didn't know which one he picked until he announced it during his State of the State address. And I was like, oh, okay, I guess that's my title now. So.
That's perfect. Do you remember any of the non-picked titles?
Yeah, there were a lot of they were all recovery based in some capacity because we knew that. We didn't want it to be something that was too like hoity-toity, but we wanted it to be something that had enough oomph behind it, I guess, where I could get a meeting if I wanted to with somebody. So yeah, there was a good dozen. I'd have to look back through my text messages, but this one, it feels good now. So it feels like it's the work that I'm doing. So yeah,
it's excellent. I mean,
thank you.
So cheers to you both.
Thank you
for it, because I feel like in this crisis we're living in, we can't rely on things that are decades old. And
Agreed.
A title is just a title, sure, but I do think it sets a tone for how we're going to work on digging out of this crisis.
Yeah, I would agree. I think it at a minimum, the title shares that this is a priority of this administration, and it's a priority of this state to continue to work on this as my position will evolve. I mean, we've been in it now for about 5 months, but knowing that it's a cabinet level position, I think sent a message to the rest of the state that Governor Armstrong, this is an important part of his administration and his work going forward.
I was Googling early this morning to try to find out if you are like the only state cabinet secretary. You're definitely the only state cabinet secretary with a title like this.
Yeah.
But nationwide. So, hey, 49 other governors, take note.
Yeah,
but I think it's amazing.
After I was appointed, the governor's office director of communications reached out to the National Governors Association and said, hey, can you give us a list of other positions like this so that, Jonathan can maybe have some peers that he can work with? And NGA sent him back, I think, a blank sheet of paper.
Seems so right.
Yeah,
Seems
so we
right.
haven't discovered any that are like this yet, that are a cabinet level position that are focused on both recovery and reentry, which are intertwined with each other, of course, in numerous ways. But yeah, it's an exciting position. It's simultaneously, I tell people, simultaneously exciting and terrifying all at once, because it's a new position. It's exciting to create something new. It's exciting to work in this space and to ultimately try to help to save lives. It can be terrifying because of the fact that it's a topic that cannot be taken lightly. We're talking
Yeah.
ultimately about life and death here. So I wake up every day, carrying that mantle with some gravity and motivation to work harder and to make a difference.
That's wonderful. But you wear a few hats, if
I
I'm
do.
correct. You're a restaurateur as well.
Yeah.
How many restaurants do you own?
I've got 2
Or-
restaurants that I own and 1 coffee shop. So
Oh,
yeah, that's my hospitality is my background. I started working in my teenage years in the restaurant business and never got out of it. At least not yet. I haven't. So
well, I would say dining is like my favorite hobby. And
same.
I've actually been to North Dakota, but it's been a very long time. So I have, is Monty's in North Dakota in Fargo, or is it
It
in
was.
Minnesota?
It was. Yep.
It's not
Yeah.
there anymore?
Not there anymore. They were one of the
Oh,
pioneers in downtown Fargo
yeah.
for fine dining, and um, my restaurant in downtown Fargo is directly across the street from where Monty's used to be. So, yeah,
Well,
yeah,
maybe I'll get back to Fargo one
there you
day.
go. Yeah,
But why I bring up the restaurants is because of your recovery workplace initiative idea,
hmm
which is
yeah,
another groundbreaking idea that I'm not hearing a lot of people talk about
yeah,
nationally.
yeah. It's there are a few around the country. A few states that have recovery friendly workplace certification programs, with all different sort of levels of detail. We don't have a certification program yet in North Dakota,
Okay.
but one of the great things about our state, the size of our state in terms of population, with it being a smaller state, is that we have the opportunity to make pretty big impacts pretty quickly when we want to.
Mm-hmm.
And one of the things that I've done with working with the previous administration, and have continued now with the Armstrong administration, is just gone out and spoken to employers. What does this look like as an employer to be a recovery friendly workplace, to support people in recovery? When I speak, sometimes I mention that, in the American sort of construct of the workday, it's not uncommon for people to spend more time with coworkers than with their families. Put in a full day of 8 hours, 8 to 10 hours, and then spend 4 hours with their family at night. So knowing that, why aren't we doing more to train our coworkers and other people in the workplace on looking out for warning signs, for being supportive of somebody in recovery? Um,
Mm-hmm.
you know, if somebody was getting chemo and they were at work and they told their boss, hey, I need to leave for an hour to go get chemo, like, we wouldn't even think twice about it. We'd be like, yeah, go ahead. But if somebody said, hey, I need to leave to go to an AA meeting for the next hour, the reaction is sort of like, well, can't you just go to another meeting later? And so I don't
Right.
think we treat the disease of addiction with the same gravity as other diseases, but
Mm-hmm.
it's the same life and death situation for many of these people. Missing a meeting, can be the thing that, sends someone off into a spiral again. So we just try to educate people on, hey, what does it look like to take some steps to be a supportive workplace, for someone that is in recovery.
What does that look like? Tell us these steps.
I think it's a few things. I think it starts off with a fundamental understanding of what the disease of addiction is and what it takes to
Mm-hmm.
find meaningful recovery. And that means taking, taking some time to really learn about it, to learn about, hey, um, what does a recovery process look like for someone? Knowing that no two recovery processes are the same,
Sure.
but I can tell you that, after I, went through treatment and became sober and a person in recovery and started to talk about it around my workplace, it's unbelievable how many of, my employees started to feel comfortable talking about their own recovery. And so even just having a an employer, a boss that is willing to talk about it and say, I understand this, and if you're struggling, that's okay. That's a critical first step in someone feeling comfortable, um,
Mm-hmm.
uh, So that's one thing. I mentioned like, allowing people the time, whether it's to go to an intensive outpatient appointment during the day, during the workday, or whether it's, going to an AA or NA or GA meeting, allowing that space is really, really critical. I think it's also understanding the difficult financial situations that people can be in when they're first starting to find recovery. Um, I often, if I've heard it once, I've heard it 1,000 times where somebody knows they need to get treatment, they know the position that they're in, but they feel like, well, I can't take 30 days off of work because then
Oh,
I can't pay my rent. So, um, getting to the place where we're not forcing people to sacrifice financial health for their overall health. So like, at our businesses, for example, like we've just made the commitment, if somebody chooses to go to treatment, we're going to pay them while they're in treatment. Um, and that way they don't have to worry about losing the roof over their head when they're done with treatment. Um, and it seems like that's a big cost for employers to take on, but uh, the loyalty that you get from employees when you do something like that, the productivity that you get when somebody finds recovery versus when they're in active addiction, like it pays for itself times 10. So, so I think the biggest thing for employers, understanding what it takes to find meaningful recovery and being supportive of people along that journey, to make sure that they can continue to be productive at work and continue to be productive in their recovery journey at the same time, not one or the other.
so while you're keeping them employed, they'll be able to keep their health insurance too,
Correct. Yeah, they'll
which
be
is
able to
so
keep the,
key.
yeah, and we often, I mean, people oftentimes get, caught up in the throes of addiction because of financial problems, right? Where,
Hmm.
start to self-medicate because they've got creditors calling them all day, right? So,
Yeah.
um, so do we really want to make that worse? By saying like, I mean, yeah, you can go to treatment, but you're going to have to take 30 days off of work and, have even less money. So I think an understanding of that goes a long way.
And okay, 30 days, you dealt with alcoholism, but for those with, say, opioid use disorder, 30 days is like,
It's nothing.
right, you're
Yeah.
really talking 90. And
Hmm.
how does someone pay for that in cash? Really, realistically, like that is such a huge mountain to climb. Having health insurance is so key.
It's yeah, it's critical. And you're right. It's not, I mean, 30 days even, I mean, for alcohol use disorder like I had,
Yes,
it's never enough, right?
enough,
I mean, we don't,
never enough.
I mean, someone doesn't go to the doctor for diabetes and the doctor says, well, here's 30 days of insulin. Good luck.
Good
Um,
luck.
you
Stop
know,
eating sugar and
right,
get,
right.
start doing CrossFit
Yeah,
immediately.
exactly. Yeah, right, exactly. So, that keeping them, in a good financial position as they proceed down the continuum of care.
Yeah.
I mean, I tell people that I was able to navigate the recovery process early on because I had access to two things, love and resources.
Ooh.
And, either one of those things, if they would have gone, away for me, I guarantee I wouldn't be here today. So,
But I think that's what a lot of people fighting the disease of addiction are missing resources and love in their life. So, which is
hmm,
very traumatic to not
100%
have
traumatic.
enough money, not have, a support system of people who love you, and therefore
Hmm.
you turn to something to replace that, which isn't a real replacement, but it might
Right.
feel like that temporarily.
I had conversations with the treatment center that I went to, which is fantastic.
Hmm.
Afterwards, years after I was there, because I remember sitting in family group and my family coming, my parents, my siblings coming, and sitting in a circle, um, and over half the people that I was in my unit with had zero family members show up. They'd
Mm.
gotten to the point where those bridges were burned, right? Their
Wow.
relationships were
Yeah.
gone. And as we're sitting around talking about it, I'm like, we're creating more trauma for these people right now. They have to sit around and look at other people with supportive families. So, I think it's also, um, when I say love and resources, I encourage people we have to be the love for people that have lost it. People like
Yeah.
me need to show up to family group for people that I've known for a month and be like, I'll be your family, while you navigate through this. So, it's a really, really critical component. And then the resources part, I had a job waiting for me when I got out. I had a roof over my head. I had health insurance. Any one of those things gone, I wouldn't be here. So we need to have enough resources for people if they choose to go through this process and do it the right way, that they're not having setbacks at no fault of their own. I mean, they're suffering from a disease.
How many businesses do you think are doing this model? Do you have an idea in your
Not
state?
enough. Not enough is the short
Sure.
answer. I mean, I think very, very few. And I
Mm.
think, Aaron, I mean, honestly, like it, what I've seen is it almost takes uh, someone in decision-making capability that has either lived or living experience for it to really take hold. And that doesn't necessarily mean you have to have a CEO that's in recovery, but um, having people that um, the disease of addiction touches almost every family in some capacity.
Does.
So having an HR director or a CEO that says like, yeah, I had a cousin or a brother or a parent that's been through this, and I recognize that how hard that was. So now I'd like to make that easier on the people that I'm charged with. Um, I think it has a spider web effect when somebody can see, okay, this is doable and it's not difficult. We're not asking people to change, to throw away their employee manual and completely write it here. We're asking them to amend one section. Um, so I think it's one of the greatest challenges that we have, not just in North Dakota, but across the United States, is to really get. I mean, think about the power of that as a force multiplier. If we had all these employers that really understood addiction and recovery and how they can support people, I think we'd have a much more productive workforce. We'd have more people staying alive. We'd have just all these wonderful things. So,
We'd have a better society and community. We'd have kids
yeah,
not in foster care or CPS. We'd have families together.
100%.
It would
Yeah,
lower what the state is spending on these things.
massively, for sure.
Yeah. Well, let me
Yeah.
let me say this word, hero. I follow a lot in opioid commission, settlement dollars, and what states are doing. You are the first person I hear really talking about this. I'm sure there's some, I don't know, big retailers and Wall Street companies that hear this and go, oh no, that's gonna hurt my bottom line.
Yep.
But is it bottom line or is it people?
Yeah. I mean, your greatest asset is your people, right? That's your greatest resource. So, um, yeah, look, it's a battle because I think, as you
Yeah.
mentioned, know, they're oftentimes those decision makers that we discussed
Yeah.
um, are not seeing the people, right? They're sitting, So I had the unique experience of sort of being the CEO, CFO, HR director, all in one of because I owned a small business, so that was my only choice. Um, so so I think, look, we like so many other things, we have to keep talking about it loudly and bravely and challenging people. And I think that's really the only way we're gonna continue to make headway.
Agreed. I think this should be legislated. I might get in trouble for saying that. Now people are going to dislike me. But they're like, oh, Aaron, that's a regulation. It's like, but is it helping? I would love for everyone to do it naturally.
Yeah, for sure.
Um, but I don't know that we can get there that way.
No, certainly not fast enough, right? Yeah,
Yeah, when we're losing what? So we're losing right now 80,000 people as a country a year. That's what's projected, which is what? The size for your state, the size of Bismarck,
yep.
probably.
Hmm.
Or if you're Raleigh, North Carolina is another place. If we just, dropped a bomb on those communities, those people died, man, women, children, we would probably be outraged. But why aren't we as outraged about this?
Yeah, my previous boss, Governor Burgum, whenever he spoke about this, always used to, and still does today, gives the
Yeah.
analogy of like, we're losing the equivalent of a 747 full of people every day, right? So think about, if that were actually happening, if a 747 was going down every day, we would stop and not let a plane leave the ground until we figured it out. So why aren't we doing that with the opioid crisis, right? It just doesn't get the same attention.
It
So
does
we have to do
not.
better.
So when this job was created for you, is this a paid job in the cabinet or is this a
Yes.
volunteer position?
No,
Wow. So
this is a full-time gig. So, yep, full-time paid job. I am a state government employee through and through.
so the governor decided to put money into this. This is a
Yep,
new expense.
it is.
Oh,
Yep,
congrats to him.
yep, it is. And he's a conservative Republican, so
Hmm.
when you add new expenses, that always comes with a level of scrutiny, right?
Always.
But he didn't blink, right? It's not, and also said, look, if this position, if we focus on this, bring it to the cabinet level, I mean, and do what we'd like to accomplish, ultimately, we'll be saving the taxpayers dollars by getting more upstream, right? And a lot of the things
Totally.
that you just mentioned in terms of societal impacts, um, this is a money saving initiative by keeping this at the forefront.
Amen. So tell me a little bit about the Recovery Reinvent conference and when was
Yeah,
this started? And give
yeah.
us a little history there.
Yeah, so credit to, Governor Burgum and First Lady Catherine Burgum, the previous governor and First Lady of our state. Right after they were elected in 2016, the First Lady, decided, the First Lady is a person in recovery, and she decided that right after they got elected, she was going to go public with her story and
Mm.
and and talk about eliminating stigma in the state of North Dakota as her platform. So out of that, through executive order, Governor Burgum created the Office of Recovery Reinvented, which the sole mission of the Office of Recovery Reinvented was to eliminate stigma, because we know that stigma is still one of the greatest barriers that prevents people from getting the help that they need, particularly in a rural state filled with Scandinavians and Germans that don't like to talk about their feelings around the dinner table, or in the
Yeah.
local cafe. Um, so created the Office of Recovery Reinvented, and really the mission of that office was just to do powerful storytelling and do stigma related reduction initiatives. That included an annual conference called the Recovery Reinvented Conference, um, which was really, well, a celebration of all things recovery in the state of North Dakota. Dr. Lloyd, we bring in national speakers. Dr. Lloyd is a speaker. Bring in national experts and really combine the science of the disease of addiction with the art of powerful storytelling and lifting up faces and voices of recovery, in hopes that putting faces and voices of recovery on a stage with a microphone that would resonate with someone who's struggling and says, if that person can get help, I can too. Um, so that office existed for 8 years, and for the last 2.5 years prior to this, I was the managing director, um, and was appointed in 2022 by Governor Burgum. Um, and the one thing that was pretty cool is we decided, if we're gonna focus on stigma, then we're gonna measure stigma. We want to make sure that our work is effective. So um, we measured stigma in terms of people's attitudes around the disease of addiction in North Dakota.
Wow.
Simple questions like, do you believe addiction is a disease? Um, and in 2018, 63% of North Dakotans believed it was a disease, and we kept telling stories. And in 2021, 74% of North Dakotans felt it was a disease. So um, those were things that were important to us to make sure that we were making progress in terms of, we know that people treat this differently when they feel it's a disease, right? It opens
Oh,
up
of course.
people's hearts and minds. It opens up funding with the legislature, things like that. So yeah, so that really That was a great initiative by the Burgum administration to change the conversation around addiction in North Dakota. And then Governor Armstrong, when he took office, said, okay, let's stand on the shoulders of giants and take this to the next level. And let's turn this into policy. And let's create a position that is focused on this every day. And here I am.
It's amazing that they have spent all this money. Is it coming out of their settlement fund or they're just legislating it out of the budget?
No, the opioid settlement fund dollars is a separate,
Wow.
totally separate. So we have not used any, any of those dollars towards any of this. So this is general fund budget items with our legislature, our Department of Health and Human Services, Governor's Office budgets. Yeah, so it's been a priority in this state for the past 8+ years, and will continue to be hopefully for many years in the future.
Kudos to them in a time where, you know, treatment and SAMHSA funding on the federal level is being cut. This is a great example of state
Yeah.
doing what they should be doing to help their people.
And it's also, I think, Governor Armstrong has said before too, having people resources focused on it with my position and others that I work with. As we travel around and ask people, what do you need? What barriers are you facing? Obviously, the easiest answer to that is, well, we need more money for things. But Governor Armstrong said, look, we're not always going to have more money for things. So we need to also be innovative and collaborative and have people that are focused on, if we don't have more money, what can we do still to solve these issues? So that's a lot of the conversations that I'm having around the state. A lot of times it's finding collaborative partners that weren't working together previously to say, how can we do this together?
Perfect.
Yeah.
And are you working with marginalized communities like the tribes as well?
We are, and that's a critical part of all that we do in North Dakota. We have 5 tribes with whom we share geography here in the state, and they're hit adversely, significantly harder than the rest of our state. There's a number of reasons for that. When you talk about the supply side, they've been really, really hit with the supply side with fentanyl coming in mass quantities. It's from a security perspective, you can't really you can't get on a plane with a duffel bag full of pills, but you can hop on a train with one pretty easily, leaving Detroit or Chicago and get dropped off in the middle of a reservation without really much security, if any. So that's been an issue. We've done things here to help with that, like just signing memorandums of understanding between law enforcement, state law enforcement agencies, and tribal law enforcement agencies to make sure that tribal law enforcement has more resources available to them. Governor Armstrong has, trips to all 5 reservations scheduled in the next few months, and, I'll be along with on those. We're going to talk about this as one of the things that we want to remain good state partners with them.
Right, because the tribes, for our listeners, they are not seeing the decrease in overdose deaths that other communities are seeing, like the general population.
Correct. They're not. And, if we look at the supply side of things, like I was talking about, and, if you look at the math, we've got people that are able in large cities to buy fentanyl pills for $3 a pill. Or less, and go sell them on a reservation for $90 a pill. So,
90. Wow.
you do the math in terms of the amount of money that can be made, and when we're talking that kind of money, then bad things happen, right? So the economics of it, the supply side, is something that is really, really a challenge right now, and it's decimating a lot of marginalized communities throughout the country, not just in North Dakota.
Oh, sure. No, I think the tribal across the country. How easy is it for, say, a member of a tribe who's living on their land, their reservation land? Like, how close are recovery opportunities for them if they were to enter recovery? Is it a distance? Like, are there any
Yeah,
Convenience?
it depends on the tribe and the reservation. We have a couple of tribes here who have done incredible groundbreaking work in the recovery space.
Good.
Our our Turtle Mountain band here just opened up Turtle Mountain Recovery Center. It's a beautiful new recovery center
Wow.
right on the reservation. Uh, MHA Nation, which is another reservation, have multiple recovery organizations and treatment centers, both on their reservation and in Bismarck, which is the closest sort of large city, right? So it really depends. Um, but one thing that we've done because of our geographic challenges in North Dakota, knowing that we're a highly rural state and we're not going to be able to have a licensed addiction counselor in every town that has less than 500 people, which is most
A lot.
towns in North
Yeah.
Dakota, um, is we have a robust peer support program. We've
Okay.
trained over 1,000 peer support specialists in the state of North Dakota, knowing that if we can't have a licensed addiction counselor, can we have someone with lived experience that's in your backyard that you can connect with when you want to get help, that can help you navigate the continuum of care and get the help that you need. So we have a lot of people with lived experience in all corners of our state that are helping to sort of work as stopgaps for people until they can get to treatment.
Excellent. So we're going to move on to another hat you wear. So we talked about restaurateur.
Yeah,
You are a cabinet member. Now you are a father.
I
So
am.
how do you discuss addiction with your children?
Uh, Openly, honestly, and often. Um,
Good.
I think I've before I was at the managing director of Recovery Reinvented, I spoke at the conference, and in my speech, I talked about this for quite a while because I think it's something that we're missing the boat on in terms of I don't think we give kids enough credit for being able to understand this at younger ages than they
Mm-hmm.
actually do. I started talking to my kids when they were in early elementary school about it, and even before they started kindergarten, because I sort of had to. You know,
Right.
we start to get questions. My wife um, is what we affectionately call in the recovery world a normie, right? She can she's not in recovery. Uh, but that I have three daughters, and they'd start to ask me questions like, how come mommy can have a glass of wine but daddy can't? So
Yeah.
you got two options. You can either ignore it, change the subject, or we can have a detailed conversation with this. And so we've just started to talk about it. This is what addiction is. This is how it impacts your dad. This is how it impacts your mom, being the spouse of
Mhm.
someone in recovery. This is how it's going to impact you as children of mine who are more susceptible to substance use disorder because you're my children and you have my genes. Um, but we we've seen my wife and I have got to see some pretty incredible stuff because we started talking about this at a young age. I tell the story that we were out to dinner one night. A server asked me if I wanted a glass of wine, and my 6-year-old piped in and said, "No, no, he cannot have wine because he likes it way too much." Which was a
That's so
funny
good.
moment for us, right? And we'll always remember
Yeah.
that. But the incredible moment happened when we went home later that night, and um, before I was tucking in my kids, I overheard my 10-year-old
Mm-hmm.
talking to my 6-year-old about sort of the details about what addiction is, saying like, "Hey, you said this earlier, and it was cute, but um, here's what Daddy means by that when he says he likes it way too much." So it had hit with my 10-year-old, and she was able to describe that and talk with that and be an ally to my 6-year-old. So what kind of a force multiplier would that be if we had elementary school kids full of allies for kids that were going through stuff at home?
Yes.
I mean, if why aren't we working to create little armies of allies at a younger age? And I think oftentimes we don't start these conversations until middle school health
Too
class.
late. Hmm.
And our
Too
data
late.
shows that by the time we've started those discussions, a lot of those kids have already started experimenting. And if they haven't started experimenting, many of them have seen trauma at home from their parents suffering from this. So we talk about it, we normalize it at home, and I think we should do that in all corners, in every elementary school, and at all ages. And I think we'd
Are you
see some.
starting any type of program like this in your state?
It's on my list. I have a long
Okay.
list.
I know. I know. Only so
Uh,
much.
but we haven't yet. I will tell you, I have spoken at a number of different schools, middle schools,
Hmm. Good.
and I don't turn down a speaking engagement offer when somebody asks, and so I hope that we can continue to expand that into elementary schools. And if you get in small groups where I'm looking kids in the
Hmm.
eye and let them ask questions, there's some magic that happens there. So um, it's on the list.
Definitely needs to be discussed and talked about more openly. Here in West Virginia, I quote Jan Radner, who is the former fire chief in one of our cities, Huntington. We have cities like you do, they're
Yeah,
smaller
yeah,
in size. But sadly, she's using naloxone to save the kids and grandkids who've overdosed from fentanyl. These are kids and grandkids of the people she was saving from oxy. It's
yeah.
just generational
Hmm.
because they see someone use it. It's never talked about. Therapy isn't given, support isn't given, and when things get tough, it's just what you know.
Yep. Hmm. Yeah. It's um, I still don't, I don't fully understand why we're not talking to kids at an early age about it. No one has been able to articulate to me the damage that that can do, if, if any. So,
Uh,
I mean, like, I look at it like, what worst thing that can happen is they don't understand it. All right, well, we'll talk to them again next year. At some point it's going to hit. Um, so,
this made me think, and my listeners have heard me say this, 1 in 7 babies in West Virginia are born addicted with neonatal abstinence syndrome. Because of this and them not getting help, our most violent public school children are kindergartners and first graders.
hmm,
It's awful. That's where the violence is coming from.
yeah,
So why aren't we talking about this? And I have a friend here in my county who has had an NAS child in her kindergarten class who like took a huge rock and tried to attack another person with it,
ugh, yeah,
um, because they weren't given the help. So how can we not be discussing this from a young age
hmm,
when, at least in my state, so many children in the population have this syndrome, and most of them are not getting the care they need for it.
we had at Recovery Reinvented a few years back, we had Dr. Lee, who was the CEO of Hazelden Betty Ford, present, and
Mhm.
he presented some pretty strong data that shows we know the markers for whether an adult, whether someone is going to be subject to or susceptible to substance use disorder when they're an adult by the time that they're 8 years old. We can
Whoa.
tell by the time that they're 8 whether they're going to be struggling with addiction. So as we talk about getting upstream, saving money, saving time, why aren't we intervening more at that age?
Exactly. I mean, I always believe it should be talked about in the home first, but in the schools, it definitely needs to be
Yeah,
implemented.
yeah,
So thank you. That's good. I'm going to go read what Dr. Lee has written about this.
yeah. I'll send you the presentation. It's great.
Please. I would love that. I'm going to touch on the last hat I think you wear.
Okay.
You're involved with your college NIL, which is name, image, likeness.
Yep.
And I bring this up because I'm an advocate with a nonprofit for expanding naloxone
Hmm.
in communities. And we did a PSA with the Old Miss NIL.
Awesome.
Um, so we did that with several of their athletes, and one of them was just signed, their football star was signed to an NFL team. Sorry that I don't follow sports as much as I should. Um, but because fentanyl, which is a big part of my newsletter and podcast hits
Hmm.
18 to 40-year-olds. That's the biggest killer. Is
Yep.
your NLI doing anything like that?
We haven't yet, but I love the idea. And, so our collective is a little over a year old, so we've done a
Oh,
lot
okay.
of learning the past year. And, I'm reminding people that the NIL collective is a volunteer gig for me. I have to focus on
Okay.
my state job first.
Of
Um,
course, of course.
we've done. I love the idea, Aaron. We've done a lot of work with our student athletes.
Hmm.
With social issues, a lot of domestic violence prevention advocacy work with them over the past
Okay.
year. So this is a natural way, I think, to expand into that. And again, we're ultimately talking about wanting to normalize a lot of the things here that haven't been normalized.
Hmm.
And that's a great
Hmm.
way to do it, right?
Oh,
That
your sports
particular,
teams are so popular. Where is it? Sorry. Oh, sorry, I shouldn't have turned around. This will tell you how long ago I was in North Dakota.
oh yeah,
The
that's
team's not
awesome
even
though.
named this, but this is
They're not.
because of the
Yep,
time I was there.
yep. I'm in my
But we
collective
still
office
have
right now, so
this.
you can see jerseys hanging up on the wall,
Ooh, there
and
we
yeah,
go.
um, yeah. So, well, in North Dakota, like we don't have pro sports, so like our college sports
Right.
teams are it. They're the role models, right?
Exactly.
So I think I would love to learn more about what you all did because I think it's a great way for us to spread awareness here too.
It is. So behind me, which this is my husband's studio, he just generously lets me use it. I always put in flowers from my neighbor flower farmer, and now I'm adding my box of naloxone. And
Perfect.
I ask every guest, do you have naloxone? And if so, where do you keep it?
Um, so the short answer is yes. Um,
Great.
Right here is
Woohoo!
one.
Revive.
So
Yeah.
I keep it in my backpack, my work backpack, which goes
Good.
everywhere with me. I've got it in my car. I've got it in my office. We have it in both of our restaurants and our coffee shop, and all of our employees have been trained in it because we live in
Love it.
downtowns
Yeah.
where a lot of unhoused population lives, and my wife has it in her purse. This is actually one of the things that I think we're in front of in North Dakota at the first Recovery Reinvented conference in 2016. We distributed free naloxone to all participants and did training, and have done that every year since. But at the second conference in 2017, there was a set of parents that came back and cornered the first lady and said, "We just want you to know that the naloxone that you gave us here last year, that we took home with us, saved our son in our home." Um, so, after we heard that story, um, it's been every year. So we've had, I think, really good access to naloxone in the state of North Dakota. Our Department of Health and Human Services has prioritized giving it away free to counties, and I think we've done a really good job of that. So yeah, I have it
Great.
everywhere
So
that
do I.
I can. Yeah, yeah, yeah.
But you would be surprised. You would be
Oh,
surprised.
for
I've
sure.
met policymakers. I have met nurses and doctors
Hmm.
who don't even have it in their car. Granted, I'm not saying they're medicine doctors, but
Hmm.
that just shows you that the medical community, and Dr. Lloyd's talked about this and other doctors that I've worked with, they're
Yeah,
not getting that addiction training in their general
I know.
medical schooling. So
They're
unless you're
not.
working in it or an emergency room doctor, you don't think about it. But you
Yep.
keeping it in your car, you never know. And I keep one in my purse. We have them in all our cars.
Hmm.
Naloxone is on us all the time. And people should never be scared of training. Yes, being in the situation of seeing someone overdose could be jarring or anxious, but
Yep.
it's so easy to administer.
It is.
It's
It
simple.
is.
It's
It
really
is.
simple. A child could do it, really.
They could. Yeah. And I would, as jarring or as traumatic as that might be, witnessing someone experiencing an overdose, I think it's even more traumatic if you don't have naloxone with you and can't do anything about
Save
it.
them. I know.
Yeah.
If it's not in
So
arm's reach and you're waiting and waiting and waiting, it does no good.
people can't get the help that they need if they're dead. So,
That's right. Well, I'm glad to hear you do it in the restaurants. I think
yeah.
all restaurants and bars should have it by their AED.
Mm-hmm.
I don't know if do you have a rule like that in North Dakota?
We don't.
No.
No, we
Yet.
don't.
Yet.
Yet. Right. Yet. Yeah. Look, we're coming up with great policies on this podcast,
I
Aaron. I love it.
mean,
Yeah.
I'm going to come and visit. It's been a good 20 years since I've been.
Yeah, it's
Only in the
time.
summer, though. No January,
It's
February,
a gorgeous
Jonathan.
day today.
Good.
Today. Yeah. Come
Oh,
in the
I
summer.
remember driving from Fargo to Bismarck and seeing all the sunflowers in the
Yeah.
summer. It was gorgeous. Just gorgeous.
Our summers here make the winters worth it. So yeah.
I like that.
Yeah.
That's the slow state motto, right?
Right. Right. Yes.
Well, we're coming up on time. 1, thank you for your generosity. 2, where can people follow you? What would you like them to know?
Yeah, they can follow me on all social media platforms. It's pretty, I got a weird last name, so there aren't many of us. So if you search
Right.
Jonathan Holth, you're going to find my LinkedIn, my Twitter, Facebook, Instagram, all of that, and it's all public. And it'll be a mix of politics and sports. We talked about the NIL
Yeah.
stuff. It's that's just the
Like
way
this
that I roll.
conversation.
Yeah,
Politics and sport.
exactly. I would encourage people to check out our state Department of Health and Human Services website to learn about some of the
Okay.
innovative programs that we've implemented in this state and funded repeatedly through our legislature. We've done a really, really good job, I think, in North Dakota with limited resources and challenges. And we can always do better, and that's, I think, why I'm in the chair that I'm in. But I'm proud of. We have fundamentally changed the conversation around addiction in North Dakota, and I think that's a really, really important first step. And having a bully pulpit that 2 governors consecutively are willing to use to talk about this, I think makes a world of difference too.
Yeah, it's wonderful. Well, thank you for coming on The Poisoning, Jonathan.
Thanks for having me.